Good morning, Your Highnesses, Your Excellencies, and distinguished attendees. It's very nice to be here. I come from Nashville, Tennessee. I arrived last night, and I'm delighted to be here. I have the privilege this morning of talking to you about integrative medicine. And, we might ask the question, just to start, what is integrative medicine? Lots of definitions. I'll succinctly just tell you, integrative medicine is, it's the unique combination of modern allopathic medicine, so utilizing the best of modern medicine. Innovative solutions for surgeries we heard earlier today, cutting-edge diagnostics, life-saving interventions, combined with traditional healing systems, evidence-based, as well as holistic practices that have been known throughout history. All of these are utilized in an evidence-based way. But it also recognizes that the absence of disease is not just health. Optimal health is not simply just absence of disease or well-managed disease. Optimal health really is the opportunity for the body to thrive. It's a vibrant state of well-being. And importantly, for this concept of well-being and health, integrative medicine is built on the foundations of lifestyle medicine. And just as we see this picture with the puzzle pieces integrated in, the center puzzle piece of integrative medicine is lifestyle medicine. And as we heard earlier, the global burden of disease is really focused on lifestyle diseases. And so at the heart of integrative medicine is the core determinants of health, of nutrition, stress management, sleep, social connections, often forgotten in medicine, and movement. And so those are the core principles. And when those are combined, it allows the body to begin rebuilding physiologic resiliency. Often our systems are depleted over time. And so by combining those traditional practices of integrative medicine with focus on lifestyle, we can rebuild physiologic resiliency. We can begin optimizing the integrated biologic systems of our body, and it empowers patients to actually take control of their health and their healing journey. So I'd like to just share a story that helps us to kind of understand integrative medicine in a more meaningful way. I was invited to Midland, Texas in 2014 after a heart surgeon came to a conference for my organization. And Midland, Texas is known for oil, cattle, and sagebrush, tumbleweeds. In fact, they shared with me when they recruit new physicians, they fly them in at night so they don't see the landscape, but they fall in love with the people, which are really the gold of Midland, Texas. I had the privilege of meeting Marcy Madrid, who was a vice president at the hospital, and her husband, Carlos. And Marcy shared with me in 2014 that she was suffering from the burden of multiple sclerosis. She had been diagnosed about 6 months earlier, had significant symptoms of fatigue, tingling numbness in her legs and her arms, was barely making it through the day, and it was impacting her role as a mother and as a wife and in her job at the hospital as a vice president. She would share that at the end of the day, she would come home, collapse on the couch, and disease is not just about the individual, it affects everybody connected to that individual. And Carlos, her husband, was picking up the extra duties of taking the kids to events, of doing laundry, of cooking. And so it was really creating a burden all around her. She had gone through the traditional practice working with neurologists on disease-modifying drugs, was not having the success that she wanted. And so she attended one of my presentations, the grand rounds that I presented at the hospital, and then the second day I did a presentation at a church, and she understood the power of lifestyle medicine and integrative medicine to begin restoring that physiologic vibrancy and resiliency inside of her own cells. So we began working together, putting together an integrative plan that is based on some of the core principles of integrative medicine. We can see here it's a whole person approach. Mind, body, spirit, social connections. We also utilize therapies that are evidence-based and safe, which is essential. Using lifestyle as the foundation for the integrative component, and working on the power of relationships. Social connections are essential to healing. Furthermore, evidence-based medicine and integrative medicine recognizes the role of the healthcare provider is expanded to that of a partner in health, a health coach, as well as an empowering physician that works as an educator to improve the health of the patient and guide them in a pathway and journey of healing. Furthermore, integrative medicine really looks at the root causes of disease. As an allopathic physician myself, working for more than 20 years, both in allopathic medicine and integrative medicine, one of the things I wasn't taught in my training is to simply ask questions: what is causing the disease? What's the root cause? And what do we need to do, not only to address the root cause, but to support the physiologic systems to provide the body the opportunity to begin healing that root cause? And then finally, integrative medicine empowers the patient to take control of their own health and to be their own healer, which is essential. So I worked with Marcy to do this with this incredibly complex body, but just providing the resources that she needed to begin healing. And just as a note, we included some of the other TCAM, traditional complementary and alternative medicine practice areas, in her care. This is a list of some of the evidence-based practices that are common in TCAM medicine. So this is what happened with Marcy. So I saw her in 2014. We did a conference in November of 2014. This is an MRI of her cervical spine. We can see inside of the circle is her spinal cord. And the white inside of the spinal cord are the inflammatory lesions of her immune system attacking her spinal cord, causing the symptoms that she was experiencing. 7 months later, June of 2015, we see her spinal cord is normal. And today, so we're 10 years now, she has been symptom-free in remission for 10 years, simply by applying lifestyle medicine and TCAM principles. And here's a picture of her brain. We can see the inside of the circle, a large inflammatory lesion in the periventricular region of her brain. And again, 7 months later, completely resolved. And so we know that when someone reclaims their health, it's not just that they've reclaimed their own health, but it impacts the lives of everybody connected to that individual. So because Marcy was well, vibrantly well, and vitally healthy, she was able to take on her role as being mother, which she was passionate about. And so to this day, she's able to be present, fully present, in an energized and vital way, taking care of her family. But also when somebody recovers their health, they become a passionate communicator and advocate for those same practices. And so Marcy wanted to bring this kind of information to Midland, Texas. So I worked with her to start a not-for-profit, the Healthy City. And through that not-for-profit, we started a conference beginning in 2015, where we brought together the local community, 700 people every year, to begin educating healthcare providers, hospital administrators, and the local population about the power of lifestyle medicine. It's amazing stories that I could tell you that came out of just that conference. We started community gardens, both outside the hospital and at schools, so children could understand where food comes from, how to grow healthy food, and that food tastes delicious when you have an opportunity to grow it. We began a lifestyle medicine center, and Dr. Patel attended my first conference there, and she opened a lifestyle medicine center inside of the hospital, integrating that within the traditional care, patients going from the coronary care unit to the lifestyle medicine center for a preventative lifestyle prescription. And Dr. Patel actually went on to become the president of the American College of Lifestyle Medicine. Other practices were integrated into the hospital, such as acupuncture and other TCAM practices. And so in this way, we can begin to see that integrative medicine really focuses on the whole person, mind, body, spirit, but it focuses on the whole person in the context of their environment, their epigenetics, their lifestyle choices, and it brings together solutions to optimize their health in a way that allows them to share their gift with the world. And so integrative medicine is an important component of healthcare today, and I really believe it's a bridge that brings together the best of modern medicine, blending it with these traditional practices, and especially focusing on the foundation of lifestyle medicine that provides a very powerful pathway forward for individuals to reclaim their health, but it also provides a very powerful pathway forward for healthcare to begin managing this global burden of disease that is undermining the health of individuals, families, of communities. And then when we look through a larger intersectional lens at the food systems and understanding how lifestyle impacts food systems, we can begin to see that integrative medicine and lifestyle medicine can serve as a vehicle for beginning to restore our environment and our environmental resources. So shukran, and thank you very much.